Hi everybody, I am Dr. T. Varun Raju, Head of the Department, General and Laparoscopic Surgery, St.Theresa Hospital, Sanath Nagar Hyderabad. Today's health topic is on hernia. So it is a common problem in the society where people notice a swelling, a balloon-like swelling which is there at their umbilicus or at the groin area. Groin means the junction between the thigh and abdomen. They notice after a surgery also. So they say that after the surgery there is a balloon kind of swelling which is coming out on standing, and when they lie down and the swelling is disappearing. When they cough, the swelling is going to again increase in size. So some of the people they have the pain, some of the people they don't have the ability to compress the head. Some of them are present in emergency with pain, vomiting and distension of abdomen. That is called as emergency. So any hernia is nothing but the intestines which is there in the abdomen. They are projecting out through a weak point of abdomen and they are settling down just behind the skin. That is the hernia. So when there is a hernia, the treatment of choice is always there is no medical management for hernia. Hernia is named at different places. When they are located at umbilicus, it is called as umbilical hernia. When it is in groin, then it's called as an inguinal hernia. When it is at the upper part of the thigh, it is called as a femoral hernia. When it is after surgery, it is called as incisional hernia. It may be a lumbar hernia or it may be a subcostal hernia, and it may be a rare hernias like gluteal hernias, perineal hernias. So in the abdomen also we have the hiatus hernia. So there are different types of the hernias, but any hernia is nothing but the structures which should be there in the abdomen, they are projected outside. So they need a surgical correction. So for them, the patients will come to the hospital and they meet the surgeon with their complaints. And the surgeon will examine the patient with proper investigations like the ultrasound abdomen or a CT scan of abdomen, and also blood investigations and cardiac checkups and other things. So usually there are many ways of doing the hernia surgery. Either it may be an open surgery or a hybrid surgery or a completely a laparoscopic surgery. Okay, so the thing is, the most of the times here now in the society they are asking the surgeons whether you can do a laparoscopic surgery or not. So laparoscopic surgery has got the advantage of minimally invasiveness. That means the patients can go home early with less pain, painkillers and antibiotics, and the hospital stays very less, most probably 48 hours. They can go to the office within about 3 to 5 days. And we put a mesh. Mesh is a kind of a polypropylene material where the hernia repair is done by the laparoscopy, and this mesh is going to be put there so that there is an additional support for that weak point so that hernia won't come again. So that is the advantage of the laparoscopic surgery. But there is one more entity that many of the times some surgeons or the patient factors hernia recurs. That means they comes once after surgery, twice after surgery, or thrice after surgery. I have done the surgeries where the 6th time failure of the surgery by different surgeons and different methods. So these are called as recurrent hernias. So they have a big hole in the abdominal muscles and it is very difficult to operate on these patients. But in our center, we have a provision of abdominal wall reconstruction, where all the muscles of abdomen are rearranged properly by doing release of the muscles. That is called as transverse abdominis muscle release, TAR surgery. Okay, this can be done by the laparoscopy or open surgery, but most of the times these big gaps after surgery failures can be done with reapproximation of all these muscles. It is possible in our hospital. So this is briefly about the common situation in the society, hernia. Okay, it can be done nicely with the laparoscopic surgery. Thanks for hearing my talk and my video. Please like our channel, subscribe, share and give comments and press the bell icon to hear my health talks from St. Theresa Hospital, Sanath Nagar, Hyderabad.